Hello everyone, welcome to today's webinar exploring the support of children's mental health and wellbeing in public libraries during COVID recovery. Today's event is a partnership between the Reading Agency and Libraries Connected, and we're really excited about our discussion here today because it's going to help us to shape future priorities for the public library health offer. So really big thanks to everyone for joining us. I'm Debbie Hicks, Creative Director at the Reading Agency, and I'm going to be chairing today's panel. But before we get off to the exciting stuff, I'd like to start with the usual webinar housekeeping. Firstly, just to let you know that this session is being recorded. Also, could you please keep your microphones on mute throughout? If you've got a question, do ask it using the chat and mark it clearly with a Q at the beginning so it's easy for us to spot, because we'll be using the questions in the Q&A session. And when we do so, if we choose your question, we'll ask you to unmute yourself to ask it. Please also do use the chat to record any thoughts or observations on the discussion, because we're going to be using that to inform next steps after this seminar. In a moment, each of our speakers are going to give their perspective on the impact of the current pandemic on children's mental health and the support that they think that libraries can offer at this time. Then we're going to have an opportunity for discussion and questions, which is going to be led by Sue Ball from Staffordshire County Council. Sue, many of you will also know, is chair of the Public Library Health Group. And then finally, at the end, Sarah is going to step in from Libraries Connected to sort of summarise our session with an overview of next steps. So before I introduce our amazing panelists, and we're really lucky to have them, I wanted to set the scene with an overview of the support that public libraries are currently offering to keep children healthier, happier and connected. So libraries' work in this area is already making a significant contribution to better outcomes for local children and families. The universal health offer means that libraries everywhere are offering quality assured health information and signposting, alongside self-management support and events and activities that stimulate learning and literacy, spark creativity and connect individuals and communities. And the offer, as you'll know, is supported by ASCL's Children's Promise, which also highlights the very important role of public libraries in children's wellbeing. We all know that delivery models are looking a little bit different at the moment, but the services provided by the Children's Public Library Health Offer remain unique community health assets. Not only are they universally available, but they're also evidence-based and quality assured. And whilst we're all hoping that they'll soon return to the trusted community space of the public library, for now they're largely and very effectively being delivered in a safe online place by staff who know and understand the needs of their local communities. Libraries' health and wellbeing support is wide-ranging, including information and signposting for children, young people and families, to local and national services relevant to their health needs. There's also emotional and social support for young families through rhyme and story times, support and resources for children and young people with autism, healthy living resources, and events and creative learning programs such as a summer reading challenge, which we don't normally think of as a health program, but which connects communities of readers, sparks the imagination and builds that reading and literacy confidence, which is such an important predeterminant of a healthy and happy life. And of course, at the heart of the Public Library Health Offer sits the tried and tested Reading Well Books on Prescription scheme, which has already reached over 1.2 million people with wellbeing support. The Reading Well for Children's Mental Health scheme, as you all know, was launched just before lockdown, joining the Young People's Shelf Help scheme on the library shelves. And we at the Reading Agency are really proud to be a partner in this work, because we believe passionately in the proven power of reading and libraries to tackle health inequalities and the big life challenge of delivering better health outcomes for children and families. We're really excited by the health and wellbeing impact of the children's work we do with libraries, of the potential relevance of shared programmes such as Summer Reading Challenge to this agenda, and of the enormous value of reading well to help children and young people understand and manage their wellbeing in a post-COVID world. We all know the world has changed enormously since we launched Reading Well for Children. The experience over lockdown with schools, libraries and other public spaces closed has seen a really massive increase in the need to support children and young people with their mental health and wellbeing. More than 1 million parents who were recently surveyed by Barnardo's felt that their child needed professional help to manage the impact of the pandemic. And whilst 1 in 8 children had a diagnosable mental health condition prior to COVID-19, Save the Children report that 1 in 4 are now experiencing feelings of anxiety, with many at risk of lasting psychological distress, including depression. children's mental health is really now a top priority for government and the health sector, including community link workers delivering social prescribing. So public libraries aren't the answer to the wellbeing challenges that children and families face post-COVID, but they can be part of the solution. Sitting alongside all these other services, Reading Well for Children in particular provides helpful reading that's endorsed by health professionals and authenticated by genuine co-production with families. The scheme helps children to understand and manage the difficult feelings that have been so amplified in current times: anxiety and worry, stressful times in the home, in school, online and in the news, and tough life experiences such as bereavement and families living with poor mental health. And although library spaces may not yet be fully open, Reading Well books are still getting to the children and families that need them most through click and collect, browsing and e-lending. There are also new library-led models of partnership working emerging with schools, the health sector and community link workers. And it'd be great to hear more about some of this work today. There's no doubt that libraries have had to pivot really quickly to continue to deliver key services in these times, moving from face-to-face to find new and creative ways to connect with children and young people digitally and virtually. But the challenge of digital disadvantage has also been a really key consideration to ensure that those children and young people who need libraries most are not left behind. And there's been some amazing outdoor events over the summer, bringing families together, and lots of work through schools and other community partners. And we're all looking forward to the time when trusted library spaces do reopen and can once again host the physical events and activities that have had such a positive impact on social connectivity and well-being for children and young people. Libraries have played a key role in supporting children and families, helping them to navigate the impact of this pandemic. But the need is massive, and there's no doubt that the future will require new ideas and new approaches. So this seminar provides a great opportunity to share best practice and think more about how best to flex the public library children's health offer to meet current challenges, to blend physical and virtual in the new normal, and to build the new partnerships and opportunities that we need to support collaboration and development. So to kickstart this discussion, it now gives me enormous pleasure to introduce you to our fantastic lineup of speakers, all experts in their respective fields and keen to join up their work with the firepower of the Public Library Children's Health Offer. So welcome to Megan Dixon, Interim Principal, Director of Literacy and Director of Aspira Research School. Megan is based in a multi-academy trust of primary schools in the Northwest and is absolutely working at the front line. So welcome, Megan.
Hello, nice to see you.
And also welcome to London-based GP Claire Etherington, who's played a key role in the development of Reading Well for Children and is also a really strong advocate for community-based wellbeing interventions. Claire's been absolutely a huge advocate of public libraries, so we're really keen to welcome her here today. So hi, Claire.
Hi, it's lovely to see you. I'm really impressed at you all talking to one another on chat. If you run Zoom for a pile of doctors and health professionals, they sit there in dead silence and just do private messages to one another.
Thank you. And then finally, welcome to Dr. Rina Barjard, Head of Training for the Mental Health and Wellbeing in Schools programme at the Anna Freud Centre, which is a charity dedicated to providing support for children's mental health services. So welcome, Rina.
Hi everyone, nice to see you. Thanks for having me here today.
Brilliant. So over to you, Megan, to start us off with a school perspective.
I'm just going to share my screen and I've got a few slides to talk through with you to give you a perspective. What I really wanted to do was give you a perspective about what it's like for us in schools in a way, and to explain to you a little bit about how, particularly in primary schools where I'm from, in the last 6 months over lockdown and before, how we've been forced to change and adapt in terms of the current situation. And I think, sadly for us, in many respects, our schools and our worldview has diminished. It's got smaller. Whereas in primary schools in particular, we were always extremely active in trying to bring and encourage children to expand and interact with the world outside. Now we've been forced to lock that down, and safety is our complete priority. And what you can see here are 3 pictures from my school at the moment. You can see the lines where we ask the children to walk. You can see the posters everywhere. You can see the limited amount of resources we have on the tables, and how even some of the areas that we have, this is where our admin assistant works, have been restricted and closed off. a very different world from the world that we had before February and the school that we had before February. Children work in bubbles, they don't communicate, they interact in very small senses, and that's very limiting. We don't go outside, we can't invite people in. We spend our time cleaning our hands and sanitizing and constantly reiterating these messages. The children, they eat their lunch in the classroom, they do their schoolwork in the classroom, they play outside in their classroom bubbles, they don't interact with any other classes across, they have their own dedicated playground space. And this is the way we've now been forced to live our lives, I suppose, in an everyday school environment. And you know, I don't want to give you the impression there isn't laughter and there isn't fun. There is, there's lots of it, but we've been forced to be really creative and really resilient about how we apply things. I was just laughing, telling colleagues that we have a pumpkin competition today. Outside my window, I've got a whole host of tables of pumpkins, but the children can't bring them inside. We've had to put them outside on tables and leave them because we can't clean them all in enough time. The other aspect is that for schools, particularly schools like mine, in this area, that we've really become a community hub. Lockdown saw us delivering free school meals, providing sources of information, signposting, supporting in a considerable way the community around us, particularly when everything else was closed. And then after lockdown, when the children returned, we've obviously anticipated a lot of things, but we're increasingly learning about the power of books in particular and reading to support our children and our families moving forward, to become aware and process some of these things. The challenges as we all settle, I think we expected children to have some difficulty in attainment. There'd be some differences in attainment, but what we've learned as well is that catching up for us is far more than just reading, writing and maths. We expected the children to find the pace of school hard, I think, to have some limits around their attention and the school day being very intense. But what we've really identified is that the last 6 months have really impacted and continue to impact on their social skills and their emotional and their interaction skills. We're seeing real differences in how the children socialise with each other, both in the classroom and outside in their play. We're seeing real differences in their play and their ability to sustain creative and strong and meaningful play for periods of time. We're seeing differences in their physical fitness, their concentration, and their ability to focus, I think. And this is across the board, all the way from our nurseries, youngest nursery children to the older ones. And then as the term moves on, we're really having to be creative and inventive about how we help children engage with new ways of learning. Typically within the primary school, we would be very interactive. We would pay huge amounts of attention to social and communication skills that they have. And our classrooms are now forced to be in lines with the children sitting individually on tables. There's less opportunity for them to understand and move together. We're developing this, but we've learned that children aren't very good at learning online. They lack that ability to communicate together, and it's really hard to respond to them in those scenarios as well. But I want to say that the one constant for us is always stories. We use stories at every point and throughout the day. The power of stories, to be able to share, to discuss, to provoke, to encourage, to enliven, to cheer up. There's always a story. And if there's one thing that we've invested even more in the last 6 months, it's more and more and more stories and books and texts and challenges and the opportunities to do that. So we've recognised from our perspective moving forward, there's all sorts of issues for us that are becoming even more abundantly clear. One of the first ones is this lack of uncertainty. We don't know what's going to happen every day that we come into school. It could be that the children come into school and we'll have to send them home within the next hour because there's been a positive case. That creates a sense of tension and anxiety that's quite incredible to understand. Unless you understand what it feels like, unless you're involved in it, I think it's difficult to step in and really understand what it looks like and feels like for the staff and the children. We've got the challenges of working with children who come in each day whose parents are suddenly critically ill or are in bereavement. At the moment, I am particularly in that position, and that challenge about how best to support them, where to go and where to find sources of support and advice. We've got the challenges of helping children to understand what they're going through, what this is all about in an age-appropriate way when we're not necessarily fully understanding it ourselves. And then, of course, the challenges of addressing the digital poverty gap that's really become evident. So the access to online resources, the ability to, and then the ability to use it, the ability to learn from and with in those contexts. And reaching the hardest to reach families and children, how we do that. We've got the challenges of providing a rich and balanced and sustained curriculum, both in school, when we've got the restrictions on what we can and can't do, but outside school as well, and when we're delivering a remote curriculum to children who are self-isolating or where the situation is that they're unable to attend. And then I suppose developing and sustaining our role in the community as well. We are continuing to be a source that's drawn on. Unfortunately, I'm working in a tier 2 area with areas of tier 3 moving. And as soon as that came out, we've had a flood of families and parents asking us, what does this mean? How do we live? How do we involve? And all the kind of raised anxiety that comes with that. So when I was thinking about this and thinking about the challenges that we are presenting and thinking about the opportunities for collaboration and partnership to create a rich and strong dimension and momentum moving forward, some of the tips that and maybe more suggestions that I have were, almost quite practical, but areas that I think would be of great value and really warmly received throughout the schools across the country. The first one was to reach out in a really practical way, to offer support really that really helps us become partners in our uncertainty, I suppose, helping us, maybe producing webinars, story times, online lessons, book groups, things like that schools can partnership with libraries and wider to access virtually, because the role and the workload involved in producing all of these materials while you're continually trying to teach children in the school as well is quite considerable. The next one is how we can marry up and work together to enhance and enrich the sustained curriculum that we're providing, increasingly more so online. And then, of course, books and text, and the right books at the right time in the right way. We don't have enough. We can never have enough, and we don't necessarily have the continual skill at our fingertips to know the right book at the right time for the child in that almost prescribed way. Another thought was around becoming partners in our information sharing role, our increased community hub. So we become not just for the children, but for absolutely essential for the families that we work with and the carers too, all the way across, and to help deliver that in terms of providing richer and wider opportunities. What that looks like, I don't know. I suppose the world's your oyster. And then again, this final one that I can't emphasize enough really is helping us and working with us to find new ways of feeding the children's insatiable desire for stories, insatiable desire. And the small little image, a bit fuzzy in the corner, shows you that's a picture of me. Every week I record myself reading a story to the children and I put it online on our YouTube channel. And and they adore it, and the next day they want another one and another one and another one, and that kind of insatiable desire to fuel it moving forward, to help us in any way to develop and enrich and provide for the children and families that we have. And it's a tough world for schools at the moment, so that opportunity to work in partnership would be really fantastic.
Well, thank you very much, Megan. Lots of really useful insights there. I love that idea of the power of stories to tackle, the social, emotional and interactional impact of the pandemic, and also lots of really practical suggestions of how schools and libraries can work together. So let's hold those thoughts and move on to Claire from a primary care perspective. Claire, I think you might be on mute.
I could be unmuted, right? I can unmute myself now. I'm hoping the screen sharing is working. Right, so I can leave the sort of presentation because Megan's done it for me, the similarities. So I'm a GP, I'm a GP in Harrow in Northwest London. I'm sitting down the road from the lady in Ruislip, and I work with a lot of the people in the boroughs that have mentioned themselves. I think that the things that overlap are the uncertainty, the difficulty of dealing with changes, how on earth we help those who need us the most, and that bit of the power of the stories. So I teach people to become GPs. In fact, I teach people to become all sorts of people who work in primary care. And the big thing is listen to somebody, find out their story, because if you don't find out the story, you won't be able to help them help themselves. So I thought I'd just say a little bit about what it's like perhaps being a patient and being a member of staff in primary care at the minute. It's, as Megan said, an absolutely massive change. Our surgeries have been cleared, they're not pretty anymore. They destroyed all our stuff. You know, my mother's Grey's Anatomy has been burnt. You know, it's actually quite a sad place to be in terms of what it looks like and how uninviting it looks. When you want to see a GP, it will be through the phone or through the internet. We've come on leaps and bounds with videos and texts and things, but even if you do need to be seen face to face, the GP will talk to you on the phone beforehand. You'll then come up to the surgery. We have a one-way system and temperature checking. If you're lucky enough to have a car and you can find somewhere to park, you can sit in that. Otherwise, we're allowing 3 people at a time into the surgery. You go into an anonymous room with the GP that the GP has personally cleaned beforehand. You get the bits of examination done that need doing. You then go back out to the car or to the waiting room, and the GP cleans everything up and writes it down and then rings you back again. So it's really quite complex. It's tiring and time consuming for us. The sort of things we're seeing, I mean, obviously at the beginning we saw a lot of stuff with COVID itself. My closest hospital is Northwick Park, which nearly folded the Easter in April when COVID came around. 3 of our staff have lost family members during COVID. It's tough. So that means our patients are going in for a tough time. I lose more sleep over worrying about people when I go home than I have in the whole of my 35 years career. As Megan said, there's still good stuff. We talk to one another as a team at 11 o'clock every day, whatever's going on, all via Zoom, including those of us who have portfolio careers or are part-time joining in. I don't think it's very much different anywhere else. You're going to have appointments via 111 to go to A&E. Lots of outpatients are being run as virtual. And if you do go to hospital, everybody's wearing even more complex PPE than ours, and it's very distance. Children, the effect of COVID, I mean, Debbie talked a lot about the studies. There's a thing called the inverse care law, which was described by a fairly famous GP about 40 years ago, in that those who don't have get even less, and the sort of things that are really coming across to us are the vulnerability of children who live in poverty or have some of the protected characteristics. If your home isn't a safe place, what must it be like being locked down in it? If it isn't a safe place, where do you get your IT access? If you're a child with another vulnerability like a long-term health condition or learning disability, we know that those children are all more vulnerable at the best of times. School closures, for many children, school is the best place and the safest place that they go to. And so when schools were actually closed, that was the real loss of a safe place and the loss of that safe adult to talk to. We've not talked very much about the images that children are getting all the time. Everything on the news and on social media is scary and frightening. The adults that they live with are probably scared and frightened. And I think there's a huge amount of anxiety, and we're seeing that. So I have contacted safeguarding more often during the epidemic than I do over 3 or 4 years. And I'm one of the safeguarding leads in my practice, so I have a very low threshold for contacting safeguarding for advice. I do, however, think there's an opportunity. Here we are on a Zoom conference, and I didn't even know what Zoom was in February. And I think the way that it has driven IT, the way that people who were not interested in IT before, is a real opportunity for us. So our local faith groups have been going around helping vulnerable people get access to IT. And the answer was most of them did have a phone or an iPad or something like that, but they didn't know how to use them. And there've been scores of volunteers going out helping people to access. So I think we've got a real opportunity to join up. So I think you could join with the GP surgeries. I don't know if people know about social prescribing. So for the last, if you're in Tower Hamlets, 50 years, but fairly recently elsewhere, social prescribing, who are people who can see you at the surgery and talk about things other than medicines that can help. In England, I'm sorry about the Welsh people here, we have things called primary care networks, which are groups of practices that treat somewhere between 50 and 100,000 patients. Those are the groups within primary care that you can approach. And I have spent the whole of COVID working really closely with our patient participation group, trying to find the people who are vulnerable and actually get specific supportive information out to them, because we are open and we should have been open in all of that time. And so from a children's point of view, we've contacted pregnant women, we've contacted parents of the under 5s, we've actually found new child carers during this time. And I think these sorts of groups are the sort of people that you could be talking to within your area. The other real source, the people who are absolutely at the front line and know what's going on, are community pharmacists. They had a really tough time at the start of the pandemic, and they do all sorts of educational stuff and are really open to being part of their community and joining in with things. So this is not exhaustive, but I've put up some suggestions, and these slides will come to you, of places that you might find somebody. In the end, I have a horrible suspicion that what you need to do is find a passionate person in your area. And so I don't know whether that's a GP or a pharmacist, but if you contact lots of agencies, somebody will pass it on to someone who says, oh, well, Claire's interested in that sort of stuff, let's give that to her. So there's a National Association for Patient Participation that might be able to help you communicate with your local patient participation groups. Health Watch is supposed to be the champion of people using both health and social services. So if you go onto their website, again, they give you details of the local ones, and you may well find all sorts of groups and ways of getting into activity that's going on. We have clinical commissioning groups, who are the people who commission local health services, and they are supposed to interact with their communities. So going and badgering on their doors and talking about libraries and talking about books and talking about what they can do. And in England, we have now, bigger than the clinical commissioning groups, sustainability and transformation partnerships, which are supposed to be drawing up place-based plans that involve the whole community. And I'm a bit of a heathen. I actually think if we get education and nutrition and well-being right, we wouldn't need that many GPs. That if you get people looking after themselves and communities working together, GPs can be the sort of icing on the cake for when you get appendicitis. And then I flagged up a couple of other things that might also be available. So primary care networks, which I mentioned, are the groups of practices who are joining together. I work with the Royal College of GPs. I actually belong to a group that is interested in shared decision making, which is actually listening to your patients and listening to them as a whole person and helping them weigh up the evidence and decide how they want to be treated, which includes huge amounts of self-care. And then I've thrown in the suggestions of the British Medical Association regional councils, which again can plug you into healthcare in the area. And local medical committees. There are local medical committees and there are local pharmacy committees, and they are often really staffed by passionate people who are often really interested in their local community, and they might be a really good place to plug into. So I think that I'll hand on to the next person, just letting us go away and think about the stories that we get from our patients who we probably only see 5 or 6 times a year. And that's the story of the whole of their lives, and that bit of making sense of it via books and resources and processing things through words, I just think is critically important.
Many thanks, Claire. I mean, thank you so much for telling us that sort of inspiring patient story and some really useful community networks for us to think about there and link up with. So finally, over to Dr. Bajaj, who is going to tell us a bit more about the work of the Anna Freud Centre.
Yes, I am indeed. Great, thank you. So the aim of, I suppose, my presentation is to share some resources with you that could be of use. So for those of you that don't know the Anna Freud Centre, we've been around for about 60 years. So everything that we do is focused on supporting children and young people. So we also work with the systems around the children and young people, because we know that young people are not in a vacuum. So, you know, working with schools, working with parents and carers, community organisations, and we're involved in a range of different services. So we offer information around research, we offer clinical services in some areas, training, and also we develop lots of resources, because one of the things that we're really proud of is the dissemination of information to as many people as possible. So all the resources that I'm going to show you today are quality assured and resources that you can disseminate as you wish freely. So I'm part of the mental health and wellbeing in schools team, so a relatively new team, and we're made up of clinicians and education professionals. So we've got senior leaders, I'm a psychologist by background, and so we try and take clinical concepts and translate them into practical tools and tips that schools can use. So how can we take the theory but apply it to the real world of a school setting? And we've been really trying to focus on that, particularly during the pandemic. So there's a range of things that we offer, so resources and school training. We're involved in a number of large-scale research trials across the UK, and a few of them are overseen by the Department for Education. So it's really taking mental health and wellbeing into the school community. We also have a schools outreach therapy programme in Brent, so they offer clinical work within Brent. We're really proud of our Schools in Mind networks. This is a network which is free to join, and it's anyone who's interested in engaging with educational professionals. So at the moment we have 20,000 national members, so it's a free network. We'll keep you up to date with the latest research, we'll share resources with you. We do have networking events, and I'm sure we're going to do something virtual online very soon. So if that's of interest to you, we'll send you the link to that. And also the Mentally Healthy Schools website is another website we're really proud of. So this is where you can find quality assured resources. So all of these resources have been quality assured by a clinician and or an educational professional before they go onto the website. So it includes things like toolkits, animations, stories, activities, lesson plans, assembly plans. So real practical things that you can use. I'm going to tell you a bit more about that in a moment. But I think at the moment we have over 500 quality assured resources on the Mentally Healthy Schools website. It's mainly aimed at primary schools, but we are developing our secondary offer. So by next year, we'll have a lot more information for secondary schools. But a lot of the actual activities that are on the Mentally Healthy Schools website can be adapted. We also have a section for parents and carers, and also a section on staff wellbeing, which I think is incredibly crucial. So I'm a firm believer that if we're going to be thinking about children and young people's mental health, we also need to be thinking about how we support the staff around them. whether that's schools or community kind of hubs. So that's the position that we very strongly come from. I'm not going to go through these next few slides in a lot of detail, but you will receive them. But I just wanted to point out that there is emerging evidence around the impact of the coronavirus. Obviously, at this stage, we're still very much in it, so we don't know what the long-term impacts might be. But this is kind of a review of the current literature, which shows us what we might anticipate. So the Evidence-Based Practice Unit is in collaboration with the Child Outcomes Research Consortium, and they're going to be continually producing a series of research bites. So if you're thinking about interventions that you'd like to offer, particularly within a community, this might give you some insight into what the current trends are within the UK, and also some suggestions for the types of interventions that you may want to offer. So this won't surprise anyone, but the initial evidence is showing that mental health is likely to be impacted by the pandemic. And what we might see in particular are higher than usual levels of stress, anxiety, depressive symptoms, and fear. And we might see that in children and young people, but also adults. And also there's several reasons for that, which have already been touched upon, but schools often are a containing and safe space. And I think they still very much are, but we're still in this bubble of uncertainty. But also things like increased time away from peers. So the peer support network being incredibly important, concerns about health, and also the media overexposure. So for some young people, how do they know how to navigate that? So they might not have the emotional capacity to really take on the images and constant news that they're being bombarded with. And there's also some indications of some particularly vulnerable groups. So if you are thinking about linking in with community resources, it's obviously really important to think about the current concerns within your local area, and that might kind of help you to target who you engage with. But some indications include young people who might be more vulnerable. So those with an autistic spectrum condition disorder, ADHD, existing mental health conditions, challenges in readjustment, perhaps attachment difficulties, or looked after children, and those facing stigma. So perhaps ethnic minority groups or LGBTQ+ communities might be more at risk, and levels of domestic violence or reported domestic violence have increased. But I think Megan might echo this, but schools probably don't know exactly what young people have been through. So there's some things that we'll never know. So the reported levels have gone up, but there still might be other risks, or children and young people who have parents with mental health needs. And some children are going to fit into more than one category. So this is not to kind of have us to make assumptions around who might be vulnerable, but I suppose in terms of the research, we might want to be more aware of some of the vulnerabilities, and also additional things like digital poverty or access to resources. So these are real health concerns and emotional concerns and practical concerns. And I'm not going to touch upon this, but just in terms of if you are thinking about interventions or services that you might be offering, then you might want to be thinking about interventions that focus on accomplishments rather than losses. So in terms of the current climate, attainment has changed. What does success mean in the now? And success might just mean surviving the day, accessing support, or coping better than you did the day before. So it's all relative. Thinking about how you can communicate openly and honestly, and that's the power of stories, because it gives you an opportunity to normalize worries and anxieties and acknowledge that they're there, but also to think about coping rather than cure. And I think that's the key thing with mental health. How can we cope better? So it's not necessarily about people having good days all of the time, but how can we cope when things are challenging? And thinking about sustaining social support and networks. So very quickly, I just wanted to show you some resources that might be of use to you, because libraries can be a community hub and also a great source of support. So I just wanted to show you some quality assured resources which might help you to signpost your communities to them. So you've got the Anna Freud Centre website, but we have developed some coronavirus specific resources. So they come under 6 headings, including supporting young people, supporting parents and carers, supporting schools and colleges, early years, mental health professionals, and research. So there's a range there, and they're all free to download and use. The Mentally Healthy Schools website, as I've mentioned, also has specific information around the coronavirus and some toolkits that are related specifically to that. That also includes information for parents and information for school staff as well. And as this is continually being updated, so we also have included some information around things like Black Lives Matter. How might you talk about that? So social issues, things around uncertainty, specific mental health presentations. So there's lots of information on there. We've also got some information around managing unexpected endings and also supporting staff. And I think that's, I want to kind of get that message across even more so. So, you know, thinking about how you support vulnerable children, but also how you support staff. So, you know, if you are working with schools, these are great resources to signpost them to, but also if you're working with parents who are concerned, these are some great resources. And last but not least, I just wanted to show you our new 5 steps framework. So this is a free framework that anyone can use. And it really thinks about a whole school approach or a whole service approach to mental health and well-being. So if you are developing policies and procedures or thinking about things like collaboration or understanding need or supporting staff, although you might not work directly within schools, this might give you some great information and some resources that you can draw on to think about your overall strategy. So everything's been collated for you under 5 headings, free to use, all quality assured, but there's a link there if you'd like to take a look. And I was also thinking about some of the top tips, and what I would say is just having information about mental health visible and available helps to normalize the process of talking about mental health. So you might want to have a few resources that you can signpost people to, or some key community organizations. But also take good care of yourself. So really think about your own well-being. You know, as I kind of mentioned earlier when we were on the call, we've almost gone from kind of running half a marathon to a full marathon, and now we're doing an ultra marathon and we don't know where the end is. So in terms of us all being in survival mode, we do need moments where we can stop and pause and reflect. So just think about your own self-care too. So how can you take care of yourself both within your role and outside of your role? Thank you.
Okay, many thanks, Rena. So again, the power of stories emerging as a theme, lots of useful resources, and some interesting thoughts around, you know, around where we need to be targeting this work. So at that point, I'm going to hand over to Sue to pick up on questions.
Thank you, Debbie, and hello everyone. So my name's Sue Ball, as Debbie said, from Staffordshire Libraries and Arts Service, and I lead on the Public Libraries Health Group. I just want to thank our speakers for those very thought-provoking presentations demonstrating clearly the impact of the pandemic on children and on families and on schools and on our health. So now we're going to move into the question time. I just wanted to say that we will save a transaction of the chat. So I'm seeing quite a few topics and themes that are coming up, and we will pick up on those afterwards. Firstly, we've got a couple of questions around communication. So I'm going to go to Tracy Meredith first, who has a question around communication. Tracy, would you like to unmute yourself and ask your question, please?
Hi, Sue. Yeah, it was just really thinking about schools, and there obviously is a lot we can offer schools, and it was just how best we can communicate with them, because I know there are kind of restrictions on their time at the moment, and we would like to go in and help schools, but it was just how is it best to kind of partner with them and work on these offers and offer them to schools really, without it just being another load of emails that they don't have time to get through. When we've got something that's really supporting them, it's difficult to get that message through to schools in a way.
Thank
Can
you,
I answer
Tracy.
that one?
Yes, great. Thank you.
Yeah, you're absolutely right, and thank you very much for being aware of the kind of volume of information and the volume of stuff that's arrived. I would say from my experience, is the way to that might be really effective is to be a bit more strategic in terms of not targeting the schools directly themselves, but targeting the next tier above. So you might contact, you know, the leadership teams of multi-academy trust, the teaching schools and the teaching school hubs. You might go to the local authority and target the school improvement teams in those contexts as well. Those people who have the ear of the school. So I'll give you an example. Every week, and every week, but also every day, I get an email from the local authority with key COVID messages that I need to read. And it's, if I've got a busy day and I'm completely run off my feet, it's the one email that I will read, because I know that the information is coming in there is really strong and powerful. So by targeting those people and getting the foot in the door, you will hit a wider range of people and be really more focused and strategic in how you manage to do it. Also, you know, there's power in scale there, isn't there? And so you might go, yeah, teaching school, multi-academy trust CEOs, teaching school hubs, the local authorities. Schools often collect in a similar way to GPs in groups in the town. So in my town, we have an education partnership where all the heads meet all together, finding out who are the key players in those scenarios as well, who can mediate and broker and then cascade it out to schools is much more efficient and I would suggest more effective on every level for everybody.
That's really
Thank you,
useful.
Megan. Thank you. Another communication question is from Sarah Garfar, who is wanting to ask about how you effectively talk to children. Sarah, would you like to unmute and ask your question?
Thank you. Yeah, so I work for Hillingdon Libraries, and my main question was just how do we discuss with children the seriousness of COVID-19 and social distancing in a way that doesn't overwhelm them or doesn't really scare them, because we found a lot that we're having a lot of difficulty with children maintaining social distancing.
Mm-hmm. Okay, can I chip in here a little bit?
Yeah.
Yeah, so I think that's a real kind of concern, and a part of it is, I suppose, normalizing the anxiety. So I think children watch us more than they hear us sometimes. So part of it might be kind of how you model your own anxiety first of all, but I think just being really clear, consistent. Your non-verbals are really important. Also kind of the way that you can communicate, so your tone of voice, but also it gives you a chance to kind of recognize that it might feel different, it might feel strange, help them to kind of name their emotion if they can, where they feel it in their body, and just kind of work with them to think about what they might need to help manage the new restrictions. So you give them a chance to kind of air how it feels, but also kind of modeling kind of practically with your body language and your tone of voice can create a different experience for them. So I think at the simplest form, that would be a way to start the discussion anyway, because I think sometimes the anxiety comes from the adults around them too. So there's some learnt behaviour that I should feel anxious in this situation. And whilst that can be normal, there's also ways to manage that as well. And so it's to keep them safe. So perhaps the why, to create the understanding, to offer a space to ask any questions, so they know that it's actually to keep them safe and for their benefit, rather than something you're just telling them to do because you are, or because it's scary.
Sure,
So
thank you. That's really helpful. Oh, sure.
Claire, did you want to come in as well?
Yeah, can I really enhance the sort of modelling behaviour? You know, if all our children see us on our phone all the time, jumping to the alerts about another lockdown or how many deaths there've been and that sort of thing, I think they see that. So it's that bit about putting your IT to one side for some time and actually just focusing totally on your child. And, you know, if that's in the house or you're going out, I'm a great believer in exercise and the power of exercise whilst you're doing things. And that's really, really easy for me to say. I have a 3-bedroomed house between 3 people, and I have access to all sorts of lovely woods near Hillingdon. But it is how we get that across. And a couple of people in the chat put the names of some of the books that have been produced for this.
Yeah, and the Mentally Healthy Schools website also has things like social stories. So, you can use that as a way to kind of explain what the coronavirus is in a language that younger children will understand. They're animated. So there's lots of creative ways that you can explore with them.
Can I just add and pick up on Rena's point that we've done and spend a lot of time talking with staff about how we're going to all communicate these messages in the same way as well. So we come together as a team and we listen to the sorts of questions and the challenges that we're presenting with in school by the children, and together we come up with a consistent way of explaining and responding to it, so that every staff member, that the children hear, get a consistency of repeated message. They don't get anything different, and we get and that I find as well, to pick up Marina's point about looking after your staff and looking after the people who are working and looking after yourself, that helps everybody kind of come to a kind of consensus and an understanding as well, which makes it all a bit of a happier place, a bit, yeah, kind of, again, those open opportunities to be allowed to express your emotions and how you feel and respond to it in a positive way.
Brilliant. Thank you. And I can see lots of recommendations as well coming up in the chat on websites and other books as well to look at. There's a question now from Stella, focusing on the blended virtual and physical offer. Stella, would you like to unmute and ask your question, please?
Yes, hello. Can you hear me yet? Can you hear me?
Yes.
You're right. Yes, it was just it's so much that somebody touched on the physical space and the fact that the loss of that to some children is going to be really, really scary. And what we're seeing in both public libraries and schools' library services is that the school libraries are also not really properly open at all, as the public libraries are, only more limited, and how can we reclaim that sense of the physical space, the neutral space, the space people go to when they do have issues around their mental well-being, because the virtual is fine, but it doesn't really do it the same way as talking and sharing stories, in a physical way. So I just wonder, if our speakers have got ideas about their own situation, or especially in the school, what's happening in their school in terms of the library space, but also how we can get back to what we all want, which is really our libraries having all these things going on in them and people feeling safe to come in, because that's going to be a huge contributor to mental health and well-being.
Thank you, Stella. Who would like to answer?
I can start. And I'm really sorry, Stella, but I don't know. It's really difficult. Our challenge is we have a library space that's shared. We don't have, the classrooms have their own small libraries, but mainly our school library is a place where people go, classes go and share, and that's really problematic for us from a keeping people safe aspect. And it's difficult in terms of keeping the bubbles separate and keeping the children from interacting with each other across their bubbles and not breaking our bubbles, the areas where they move in. That physical, we are lucky in terms of in primary schools, the staff within there do share stories, they do have that interaction, they do have class sets of books, and we are constantly buying new texts for them to use in those class spaces. But I'm really sorry, but I'm a bit of a loss to know how we go forward, really. Maybe other people have got some better ideas, but I'm kind of stuck in this groove at the moment.
I think for me, there is the practical challenge around safety and when it will be safe to return to physical spaces, and also what that will mean emotionally for people. But I'm just really struck that this is about longevity as well. So this is an opportunity to continue to build connections with your community. So even if people feel connected to you, that's still really important, even if there's an acknowledgement of the loss of the physical space right now. So I really liked Megan's idea around the videos and storytelling, because that's the way to connect. And I was just thinking about kind of my private practice as a therapist, because that's also moved virtually to, and it used to be kind of face to face in a room. So there is something about maybe when you're interacting with people, how you mark out that space as being different. So even though it's kind of not the ideal physical space, and you might acknowledge that, but just thinking about how you mark out your time together, whether it's kind of starting a session or a reading of a book in a certain way and ending in a certain way. So there's still a different connection to that space. But yeah, I think it is very challenging. But for me, I think the opportunity to still connect, even if it's virtual, is still really important, even if it's not the ideal.
And I agree. I mean, I think we all took a breath, and I think Megan was brave for being the first person. I think that bit about connecting and trying to be more creative about how we do joint activities in our kind of online stuff. So I can see that people are writing stuff in the chat about being outside, and if you're lucky enough to be in a school that has access to an outside space. My husband was working in Winnipeg for a while, and parents in Winnipeg have to sign a consent. Is colder than -25. They will not force the children out to play without their parents' consent, but before -25 they do, and they go out, and nearly all parents sign it, and they go out in all weathers. Nobody in this country dressed decently, can fail to cope with a bit outside. I've learned a new coaching technique during lockdown. So some fabulous therapists have set up something called pit stops, which are some 10-minute sessions for healthcare professionals who normally prop one another up with 10-minute conversations in corridors. And one of the things they've brought in with that is right at the beginning, doing some movements, so swinging your arms around or something in a planned and repetitive way to kind of get you into the space. And you could do that in a tiny classroom. Even if you only got 6 children there, just getting them focused on all doing the same physical repetitive movement. And I've been really, really stunned by how quickly you can go into that quiet space and forget the patient you saw before and the patient you're going to see next, and actually have a decent protective time.
Okay, thank you. I think we're running out of time slightly now, so I'm aware we've got a few other questions, but we can pick up on those later. I'm going to hand over to Sarah now, who's going to close the webinar. Over to you, Sarah.
Thank you, Sue. First of all, just to thank the speakers who've just been amazing. And I think, when we set this up, we were kind of trying to think what was the themes and how would we pull them together. And you've all kind of linked together so well. And I think it's been a really powerful webinar. I just pulled together some kind of common themes, obviously the theme of story running through that and how public libraries can support schools. And I've seen all the chat about publisher permissions and all of those kind of technical things. But I think the power of story, and also that there are stories that can help children, particularly during this time, and maybe there's something we can do around pulling together those book lists that we can share with everybody, which is a simple thing but often very helpful. And I think the stories as connectors has also come up really strongly, so that bringing together people, if it's online or virtually. I think there's something that's come out quite strongly about signposting, and again how public libraries can use their spaces and their online spaces as a way of signposting schools and parents, which is really important. And I was also quite struck by the idea of much more partnership, that schools are community hubs and so are libraries, so how can we work those together and bring those together. And I also, the other thing that was coming through was just the sort of uncertainty that we're all feeling, and what that must be like if you're a child and just not sure where to go, and how we can work together to support children who are feeling that uncertainty. I was very, very struck by Claire and the sort of the images of fear that are around us all the time, and how do we combat that, and how do we support children to understand what those are, but also give them the positives as well. And I was also struck with the taking good care of self. I think that's really, really important. And the other thing that struck me from Megan's presentation was about, that children's worlds are shrinking, sadly, really, that they haven't got that access to the outside that they've had before. And how can the public library work with schools to widen that world in other ways? And we know books are a great window on the world, so how can we use those more effectively to do that? And the thing that was coming out at the end was evidence and impact. How can we share the evidence about what we're doing and the impact of our work? So I think we've got lots and lots to think about, and also joint online activities. And maybe there are opportunities for more joint online activities with schools and for parents, particularly to support families. So I think those were the kind of things. I've made huge numbers of notes, so there's probably loads more that we need to go away and digest, because there's some really interesting stuff coming through on the chat as well. So I just want to say thank you, all three speakers, to Rena, Megan and Claire, who were all brilliant. And also thank you to Sue for chairing it, and to Debbie for introducing it so well. It's been lovely to work in partnership with the Reading Agency and libraries on this. So thank you all once again, and hopefully we'll see you soon at another webinar.